Good afternoon. I'm George Latimer, Westchester County Executive, and this is our Monday weekly update on the COVID-19 outbreak in Westchester County, and we'll touch on some other issues as well on Monday, September 21st. I'm joined today, and I'm going to introduce him more formally in a second, by the mayor of the village of Elmsford, Bobby Williams. And Bobby is going to join us to talk a little bit about what's happening in the village of Elmsford. As you may know from some of these reports, we started doing these updates back in March when the coronavirus outbreak originally started. We were doing daily updates, and then we ratcheted it back now to weekly updates. And then if we have something of urgent importance, we'll provide that. But we started to ask the various mayors and town supervisors to join us so they could talk a little bit about their municipality. There's 45 separate villages, towns, and cities in Westchester County. Each one is a bit different. Each one has its own flavor. And as we've dealt with the COVID outbreak, each of them have had to rise to the occasion. And I must say, all of the local communities have been under the same stress the county's been under. And we try to be a good partner to them. And sometimes we have issues that, put us sometimes at odds. But more often than not, we're trying very hard to respect the villages, towns, and cities and become a partnership as we fight this. And Bobby and his team, Mike Mills and the members of his board, Ed Rush and the rest, have been really terrific in working with us. So we're going to ask the mayor to talk in just a couple of seconds. Let me go over the basic numbers, try to give you at least a little rough interpretation. And then when we open it up, if there are any questions from the press, you're welcome to give Catherine Chaffee communication. She's our director of communications, so she's very good at communicating. You can reach out to her, and she'll be happy to give us any questions. As of the information that we've received from the state of New York as of today, and this updates us overall, we currently have a grand total of 37,837 people that have tested positive for COVID over the course of the pandemic, which goes back to the 1st of March. That number is slightly higher than it was yesterday. We had 36 people tested on Sunday into Monday that tested positive for COVID. We take out as a subtraction the number of people that tested 2 weeks ago because they would have gone through the incubation period. I say this every time. I assume if you haven't heard it before, you need to hear it for the first time. But after a 2-week incubation period, the individual has had their antibodies fight off the disease, and they have passed the point of concern or danger. We have 37,277 people that have had that happen. Many of these are people for whom they were infected in March, April, May, or June, and they're long since past it. But as an aggregate number, that leaves us right now with 560 individuals who have tested positive for COVID within the last 2 weeks that we're still watching to see what the impact of COVID may be on them. And we've gone now for almost 4 months of solid reduction in the amount of illness that's been generated by COVID. The number of positive cases, the number of active cases are important statistics, but even more important are how many people have become sick enough to be hospitalized, and then, of course, the ultimate terrible result of how many people we have lost, how many fatalities there are. Of the current 560 active cases, that represents a small fraction of the total number of people that have tested positive. We are now dealing with over 93% of all the tests that we've administered have come back negative. But a negative test is a snapshot. It's where you are at the moment that you take the test. And in theory, you could be exposed to the disease shortly thereafter, if not, a week or 2 months or some other period of time after. Year to date, we have tested 625,565 individuals, 625,000 in a county of 1 million people. By percentage, that would be 62.5% of the population. Now, there are duplicate and triplicate tests within that macro number. That's all the tests given. It doesn't specify if a person has been tested multiple times, and that might happen now over the course of a 6 into a 7-month pandemic. But that's still a very high percentage of the number of people in Westchester County. And if you followed, what you've heard from the CDC, Dr. Fauci, Dr. Birx, and other individuals that have been on national television, they always talk about the amount of testing being an essential element in knowing what the widespread nature of the pandemic is. So the more you test, the more you're in a position of knowing how many people are potentially affected, and then you can do the quarantining, the isolation that's necessary to stop the virus from spreading further. And we've had a good run of that now for quite a period of time. We're now starting the first day of fall. We have survived the whole summertime period. All of our beaches and pools that were open now closed. All of the summertime vacation travel, the 4th of July weekend, the Labor Day weekend, all of those crucibles we have now passed through. and we still, in Westchester County and in New York in general, have kept a low level of infection. We try to monitor a number of different numbers. I went through that sort of last week in some greater detail. Sunday is one of the days we probably test the least amount of people of the 7 days of the week, but we tested overnight about 3,500 people, and we had a total of 30, let me make sure I get the number exactly right, 36 positive cases. So 36 out of 3,500 tested is slightly above 1% of all the people tested. And that 1% mark of infection is a very good indicator of low spread of infection. If we were testing, as we did, 3,500 people, and 200 people were positive, that'd be a much higher percentage, and we would be very concerned about what that would represent. But when we're in that vicinity of 1%, even 2% or 3% is a relatively low infection number, and we have now gone consecutive days at 1%, slightly above, slightly below infection rate. We think that is a good sign. We don't have a vaccine for this disease. We don't have an antiviral treatment for this disease. So no one can say we're in control of the disease. But you try to manage it. And in the act of managing it, we make the decision at local government levels, a mayor of a village, a town supervisor, a city mayor, a county executive, what do we keep open and what do we close if the infection is spreading fast or slowly? And we have control of our parks. And, Mayor Williams might determine that a particular park with children that would play in a playground, if the infection spike came in Elmsford, he might have to make the decision to close that park, amongst other things. We would make a similar decision at the county level to control certain things. What we do with our bus system, if we saw that there was a big reestablishment of the kind of infection rates that we saw back in March and April when this thing was spreading like wildfire, we would have to make decisions to close things. Ultimately, Governor Cuomo has the great overarching executive authority. He is the one that's made the decision that you can go back to school, the kids can play sports in school. All of these different decisions really reside with the governor's authority. But the mayor of a village and the county executive of a county have some responsibility, and that's why we look at the numbers. That's why we want to know what is the infection rate, in my case, countywide, but also what is the infection rate in different municipalities. Now, we put out every weekday from Westchester County a map of Westchester County, which indicates how many active cases there are as of that day in each of the 45 municipalities of Westchester County. And even though this is dated by a few days, it shows the total number of cases that have occurred within the in the municipality, but how many of those are active cases? So to use the biggest number, Yonkers is the largest city in Westchester County, 200,000 people. Since the beginning of the pandemic, they have had 7,834 people test positive for COVID. 7,834. But as of today, they have 119 active cases. And that's a very small number. So when people say, oh, how many people have tested positive? 7,000 people. It makes you feel that this is rampant in the street. But when you look at active cases, since the vast majority of those people have cleared their infection period of time successfully, then that gives you a more accurate indication of where we are. What is also an indication are those of fatalities. And, as I say every time, I never want to minimize what even one person's death may be. I think of my father and my mother when they passed away, how important that was to me. That wasn't a number one person. That was a person that I loved. And every person that dies has somebody who loved them, knew them, cared about them deeply. So every fatality is to be mourned and understood. That's why we created the Ribbons of Remembrance program down at Lenoir Preserve in Yonkers, so you can go and mourn that individual and leave a little remembrance on a ribbon and tie it to a tree and have something that, a place where you can mourn, where you can connect, because so many of us now do not have during this pandemic the traditional wake or shiva or graveside burials that happen under normal circumstances. But I do want to point out that when we do deal with the numbers of fatalities, we have seen now what is in essence, encouraging news. Over the course of the last 7 days, there have been no fatalities. The last fatality had was a week ago, and if you track back before that, the total number of fatalities, we had 2 fatalities as of 2 weeks ago. And since there were no fatalities in that particular week, those 2 fatalities are the only 2 fatalities we've had for the last 3 weeks. Now, this is in a county where at one point in time we had 35 deaths in a night, 40 deaths the next night. horrific. And I never want to see those days again, which is why we're prepared to shut things down if those numbers go up again. We don't want to do that. No one wants to injure the economy any more than it's been injured. But we also know that the economy can't function if the disease is running rampant. So the logical thing to do is to monitor, do all the things we've just talked about, test, identify, isolate, contact trace, which is the detective work to find out who was I in touch with for the last 2 weeks, to isolate those people. And if we have to isolate those people too to stop the spread of the disease, we stop it so you don't wind up hospitalized, you don't wind up as a fatality statistic. That is the whole thrust of what our policy has been. And if you think about it, to execute that policy, no one government can do it. You have to have cooperation across the board. You have to work closely with the medical community, the hospitals. You have to work closely with the nursing homes. You have to work closely with the not-for-profit organizations, the clergy, the small businesses, that whole combination of things to implement this. The policies may come out of the governor's office, but they have to be implemented at our level. And we have to learn as we go along. If we make a mistake, admit it, fix it, and chart a different path. We do ourselves no good to tell you fairy tales, to say, well, everything is fine, don't worry about it, it's all going to be good. We're grown-ups. This is a difficult thing. We're working through it. I don't like to wear a mask any more than anybody else does. I'm not wearing it now because I'm at the microphone. I'll put it back on when I step away from the microphone. But that is one of the sacrifices we have to make. And there are others. Social distancing, the constant hand sanitizing, remembering to put the mask on when you leave the house, remembering to sanitize your hands all the time. Those are things that we haven't put into our culture completely. But here we are, 7 months into it, and what we're doing is working. That's the key. It's pragmatic. It's what works. And what's working right now is that people like Mayor Williams and other local elected officials across the board are also being pragmatic. And I would highlight, at a time when there's a great degree of controversy in the country, we can't deny what we see. This presidential election going on, it's very, divisive, that we're trying to work together, regardless of political party at the local level, regardless of what level of government we're at, to show respect to each other. And if we disagree, but keep that basic relationship intact so you can accomplish things. And hopefully, in terms of the pandemic, address it well enough so that the people of Westchester County can feel safe as they come and go. So I'm going to ask Mayor Bobby Williams now to chat a little bit about Elmsford. He is a longtime mayor. He has been elected and reelected by his village in, 2-year intervals, and has served over an extended period of time. He is, one of the nicest guys you'll ever meet. We happen to be in different political parties, but we're on a good, working, friendly relationship. I have great respect for the work he's done in Elmsford, and the people of Elmsford obviously agree with his electoral record. So I'd ask the mayor to come by, talk a little bit about Elmsford, give us a little idea of what's happening in that community. Mayor Williams. Thank you for coming today.
Good afternoon. I would like to thank County Executive George Latimer for the invitation to join him here today. It's an honor to be here. Thank you, sir. On behalf of all of us in Elmsford, I thank the County Executive and all his staff for all the great work they've done during the pandemic. I know for sure that the things that were put in place under his administration to safeguard us helped save many lives. Your conference calls with all the municipalities have been so helpful and informative. Thank you for doing that. Back in 2007, the Village of Elmsford adopted a pandemic flu plan. When the pandemic started to get here, we dusted it off and put it in place. It was a good document to have as a starting place. The pandemic has challenged us in Elmsford, and I'm sure my colleagues around the county. It was hard working with only half our staff, deciding what priorities will get done and what would wait. The people in Elmsford know it's not me to have to wait to do something totally out of my character. Early on, it was hard getting the PPE because the whole world was competing for it. That made it difficult to operate because we had to make sure our first responders were protected so they could be on the front lines for us. Not too long into the pandemic, County Executive Latimer was able to secure PPE for the communities, and then we were able to operate without fear of running out. Again, thank you for that. Another of the difficult tasks was getting the new information out about the pandemic to members of our community to keep them safe, because it was constantly changing ever so quickly. What had to close, what was allowed to operate with limited staff, what guidelines had to be followed because local governments are the enforcing agents. We were constantly sending out information to our residents and businesses for relief that was out there for them to pay rent, payroll, and to survive. But we managed to get through all that. Then came the reopening phases. This provided just to be as hard as the closings were. Everyone wanted to reopen and get back to work at the same time. But the phases worked, and the village partnered with the businesses to make things work to get them open. I waived all permit fees and zoning rules to make outdoor dining work. Made room on sidewalks for waiting areas and other businesses to have customers wait to go in. Helped with traffic at the drive-through places because they were overwhelmed, and so much more. Then we started to open our parks for recreation that was allowed to take place. Our residents were dying to get outside. We did a couple of drive-in movies to give the residents something safe to do, but all our big events we had to cancel. Now it is on to opening of the schools, working with both the public and the private schools to make opening safe and normal as it could be for the children and the staff. I'd like to thank our school officials for our great partnership. There are 2 food pantries in Elmsford all year round. We've been doing them for many years. Once a month, each distributes food to our residents. I want to thank the Elmsford residents for their food donations, monetary donations, and Feeding Westchester for all the tons of food that they distributed to feed over 500 families each month during the pandemic in Elmsford. All of you are lifesavers. Please allow me a minute to tell a story about dedication. And this story could be told about all our county employees. Last Sunday, I texted County Health Commissioner Dr. Amler because I had a question that might have been very important. Not only did she answer me back, but she called me instead of texting me on a Sunday. I apologized for bothering her on a Sunday, but she said, "Don't worry, my husband was cooking dinner and she had time." I again apologized for bothering her family. She said, "No bother, it's my job and I love it." After she answered my question, we then went on to talk for about 15 minutes about everything else. We didn't want to hang up. When I was done, I told her that if we ever get another pandemic, that the people after us should take out this playbook that the county executive and her and everyone else that had input to it and follow it, because we got it right. But as we're getting closer to being back to normal, along with thanking the county executive and his staff, I would like to thank my board members, my administrator, and my staff for going above and beyond to assist the people in Elmsford through this pandemic. The COVID-19 pandemic has been a challenge for all of us, but we're getting through this together. We hope and pray that there is never another one. Thank you. Thank you for the opportunity.
Thank you very much, my friend. Yes, sir. Thank you. I want to thank the Mayor, Bobby Williams, for joining us here and talking a little bit about Elmsford and the way they've responded to the pandemic. For those of you who may live in another part of the county, Pelham or Pound Ridge or Peekskill, it's very easy to find Elmsford. If you take 119 west out of White Plains or east off of the river, if you come down 9A from the north or come up from the south, you'll get right into the heart of Elmsford. And as my waistline shows, there's many outstanding restaurants. They're open for indoor and outdoor dining. It's still September. You can still do outdoor dining very comfortably. And put a few dollars in the pockets of our Elmsford friends would be very much appreciated. But thank you very much, Bobby, for being with us today. Let me go over a few other issues. We covered last week 2 major announcements about money that we have through the CARES Act, which stands for the Coronavirus Aid Relief Act. And we've used some of that money that the federal government has given us to assist in 2 basic areas where we've had impacts from the COVID outbreak. The first one is in the area of businesses. There are many businesses that have struggled. Many have gone under. The federal government had a couple of programs, the EIDL program and PPE, the Paycheck Protection Program, and the economic assistance for the emergency distress of businesses. We have now taken some of the money that the feds gave us, and we have allocated it for a grant program. The application started today, where we're targeting small businesses for grants, not loans, grants, up to $49,000 to help them stabilize their business. Now, $49,000 in and of itself may not be enough to do that, but it allows them to buy things, implement things that would be necessary for them in order to function if they haven't already been able to open because they need plexiglass covering at the checkout line, or if they're a facility where people walk about and deal with product that they have to protect the individuals, if they need PPE for their purposes, if they need to extend something in the back of their building in order to accommodate people to get curbside pickup or off curbside pickup. All of those kinds of things are allowable expenses. The business has to be 99 employees or less. They have to have been a viable business prior to when the shutdown order came from the governor, which was on March 7th. And they have to be able to show that they are not part of a national chain, local franchise of a national chain, that they are a local-based business. And if they can do those things and assert accurately that they have been suffering through this, then they're eligible for these grants. There will be many more applications than there are money to give out. And so there is a scoring process by dint of a host of different issues that would represent money given to get the greatest possible economic benefit. And then those that may not be funded in the first cycle, we'll look to see if there can be a second cycle and assist some of those businesses that way. If you want more information on that program, Westchester Catalyst is the internet connection. And if you go on that and click on, you'll see the information about that program. We have a smaller program that's been out there for smaller grants and loans, $10,000 to $25,000, just for PPE. And we've got a number of applications for that. Those will be awarded through IDA money, Industrial Development Agency money, which is under the control of the county. The CARES Act money is under control of federal government. So those programs have been put in effect. We announced them last week to help with businesses of a certain size and smaller dealing with the COVID outbreak. We've also implemented a number of programs that are going to go into effect to try to deal with people and their housing needs. We have 4 separate programs. One of them deals with individuals who may be suffering foreclosure of a home that they owe, but because they've lost their job or lost the business that generated money for them, that they will then be able to get some assistance in foreclosure protection. And that's very important. Then there are 3 other programs, and I'm not going to go into all of them now. We did that at the press conference last week. All of this information is available if you go on our website at westchestergov.com. But each of those programs, some of them involve CARES Act money, which are then available to people all across the county, and then some of them are targeted to those urban county consortium communities, which are the smaller communities of Westchester County, and that money is funded through separate HUD funds. Elmsford is one of those communities, has benefited from those funds in the past for other purposes. And we encourage you, if you have a housing situation, to go to one of a number of different organizations who can be your advocate on these issues. Last week when we had this, we had Westchester Residential Opportunities representative with us here. WRO is one of those organizations that can provide that help. There are a couple of others out there, community housing initiatives, and then depending on the program, we have the Bridge Fund working in one particular area, HCSW, Human Development Services of Westchester, and there's a couple of other organizations as well. Go on the website, you'll get all the details. The important point to mention is that we're not just taking this money from the federal government and COVID and sitting on it and trying to figure out how to balance our budget with it, but rather trying to do initiatives that we think will help those people who've been injured by the impact from COVID. And in one case, housing, and in another case, business. And we think those are productive use of money. We hope that they'll get to the right people. And we hope that will help because, we want to see the outbreak lessened, but what's most important is beyond our control. We're not, going to decide. Medical science will decide when the proper vaccine is available, when it's been properly tested and can be administered to humans across the board, and they'll determine when there's an antiviral treatment. So if you get the disease and you're in the hospital, that you could be given the antiviral treatment and you can recover and hopefully go on about your life. Our job is to try to manage that which is the aftermath of it, and in managing both the issues of housing and the issues of economic development, we try to use the money productively. Mayor Williams mentioned the issue of feeding, and the county has also used funds from that resource, $3.5 million to expand our feeding program around the county. Some of it went to Feeding Westchester, so that they could continue their work. Some of it went to local food pantries so that they could expand their purchasing of items to hand out, and then to subsidize some of the innovative pilot programs that are happening in different communities that may be a path for us to deal with it. We don't think of food insecurity as something that matters in Westchester County. We're a wealthy county. We're seen as a county of millionaires. Everybody's got, a meadow with horses in the distance. But under normal circumstances, a significant portion of our population does not necessarily have the resources to buy sufficient food for them and their families. And during the pandemic, when people have become unemployed, when benefits have run out, when the need is greater than the natural supply from the not-for-profit world, which does a tremendous job of providing that assistance. We've stepped forward as a county government to assist in that process. There is no way that we have the resources to solve all of these problems. We ourselves face a fiscal problem. We're trying to work through that ourselves. We hope that as we get closer to the presentation of a county budget for 2021, we'll be able to show a path by which the county will be fiscally stable as much as possible. We do need help from the federal government, but we're not taking the attitude of sitting back and doing nothing and waiting for federal help. We're trying to be innovative and cooperative on our own initiative to do what we can. So in all of these different areas, food insecurity, joining housing and business, we're trying to respond to this pandemic in as intelligent and a productive way as possible. Just want to mention during this brief update a couple of other issues. We're very pleased to announce that we have reached the 2010 level of response for Census 2020. That means that the same percentage of households that responded through the whole of the 2010 census report has now been reached, and we still have another 10 days or so before the census area is completed. We have more work going on in the field, so by all expectations, we will surpass in Westchester County the census numbers from 2010, and that is very good news. And that is to the credit of lots of individuals on our team. Emily Saltzman, Blanca Lopez, Norma Drummond have all been very active in trying to advance the census issues, but credit the local community census teams as well in every community. We now have 6 communities that have greater than an 80% response. That compares to no communities having an 80% response in 2010. And there were a couple that made it in 2000, but we've exceeded that number. We have 2 communities that are still below the 60% line, Mount Vernon and Portchester. Both communities have active census groups. They're doing everything they can. In the days of COVID, we've lost the ability to have community meetings and rallies and things that would have helped us. So we've had to use the tools that were available to us, electronic communication, rather than face-to-face communication, which is always the best way to reach people. But we're encouraged that we're doing where we are. We are pacing ahead of New York State, and we're pacing ahead of the United States percentages as well. Westchester County still has a ways to go. We still have 9 days, 10 days, counting the full day of today ahead of us. There's been some court action. That'll be resolved. If it resolves itself and we get additional time to complete the census, we will take it gracefully. If it ends on September 30th, it ends on September 30th. But we will do everything we can. And we're doing it because if we get an accurate count of the number of people in our county, then we can apply for the kind of funding at the state and the federal level that will help those communities. We then also know that the representation, when it's created in legislative bodies by number of people, will be more accurate for us. Our percentage of seats in Congress depend on what our accurate population is. In a village like Elmsford, given its population size, if it is undercounted, it would get less money in grant days. For example, we distribute sales tax revenue to municipalities on a certain percentage. We have to operate off of the most recent census data to make that percentage share back. If an Elmsford is properly counted higher than what's listed in the 2010 census, that means more money for Elmsford, and that means Elmsford can use it productively in its community, and that would apply to any of the communities of Westchester County. So I think the last time I looked, out of the 45 trackable communities in Westchester County, slightly over 30 of them have exceeded their 2010 numbers, and that's very encouraging, and we hope all the rest will happen. So that's a bit of good news on the census front. Excuse me. I would also like to mention that as we are approaching now the end of September, entering the last quarter of the year, we delayed the annual State of the County message. State of the County message is usually done in mid-April, and it's my opportunity to speak before the legislature and then by extension publicly to all Westchester residents to describe the challenges that we as an executive administration sees ahead of us and what we intend to do. We postponed that when it was scheduled in April because we were in the middle of the pandemic and nobody could see exactly how we would handle it. And we had to be realistic about what we could project. But that address is scheduled for, I believe it's Thursday, October 8th at 7 p.m. It'll be live on Facebook. We may have media covered as well. Live. We'll see how that plays out, but you'll be able to see it yourself on Facebook, Westchester County Government Channel. And I will be presenting in the chamber of the Board of Legislators, and the legislature will be present, but there will be no guests, in the seats, sort of the way Major League Baseball and the NFL and so many of these sports are playing. We had a wonderful Winged Foot U.S. Men's Golf Open. Terrific tournament, one of the great majors. No spectators, which hurt us economically, but at least we managed to keep the great tournament in our home. And so similarly, the state of the county, which is a lot less interesting to most people than the golf tournament was, will happen without an audience. But we will speak candidly and straightforwardly to the legislators and to the people of Westchester County about where we see ourselves as we are now a half a year deeper into the year 2020. That is, again, Thursday, October 8th at 7 p.m. We've also seen that there was an announcement that there was going to be a reduction from Con Edison for residential customers who suffered through the recent outages. We were told that the credit will be somewhere between $2.67 to $3.20 credit against the $16 base monthly customer charge. That is not an acceptable number of reduction for the pain and suffering that Westchester residents went through. We're going to register that complaint with Con Edison. We're not looking to fight unduly with Con Edison or any other utility. We recognize Con Edison has done some very charitable things in the community, separate and distinct from this, but we suffered, the royal we of Westchester County suffered when Hurricane Isaias came through slightly over a month and a half ago. And that needs to be reflected in something that the consumer can look at and say, we understand that we didn't provide for you, and we are going to take that into account in the way you build. So, I'm not going to flail my arms around and raise my voice in a theatrical way. We try very hard to be precise and professional in the way we operate, and we know that what's proposed is an inadequate response to the pain and suffering that people suffered during that period of time. Some folks going 7 days without access. We don't think a $3 reduction is adequate, and we'll highlight that. So with that, that summarizes some of the key things that we wanted to mention. There are many other things happening every day. We will reserve the right, obviously, to come back and do additional press conferences as we have something important to announce. Certainly, anything that deals with COVID, we will do that. But, we want to show, and I think this was implicit in Mayor Williams' response, we want to show that we have a serious concern on our hands, but we are not in fake crisis mode either. We're not going to have everyday updates to show you the little tick of things. We're going to try to deal with the issue responsibly every day. We had an outbreak in Pleasantville that dates back a month now, almost a month, and we have not seen a spike that came out of that. We've had incidents in a couple of the schools that have opened where individuals have tested positive in this school and that school, but they haven't manifested themselves in an across-the-board increase in spread. And we want people to understand that we're in the long haul, diligence, discipline every day, but this is a matter-of-fact way of how we're going to deal with this. And as I've often said, I'll say it one more time, this is what my mother and father taught me the Great Depression was about and the war years, that they had to show discipline every single day. There wasn't a parade when you finished a week of discipline or a month of discipline or even a year of discipline, but you steady at the helm, you kept on going day after day. That's what they told me. I didn't listen very carefully when they told it to me when I was younger, but I understand it now as a mature adult, and that's what it's going to take, and that's what we're going to try to do here in the county government. With that, Catherine, do we have any questions from our friends in the press?
We do. We have two questions. The first is from David Proper from the Journal News. Are you surprised the number of active cases has remained around the same throughout the summer, considering travel, quarantine fatigue, and more of the economy opening up?
Well, I think, and if you heard the question, of course, I think the stability in the number of cases tells us a couple of different things. The first thing it tells us is that we're testing at a significant level, so that if we do have 35 cases a day, that's not an insignificant number of new cases, but it's proportionate to the number of people we're testing at that 1% ratio. When we see that number jump up, as I said earlier, that would be shocking. And obviously, if the number went down to near zero, we would be ecstatic if that were the case over a multiple number of days. But I think it shows sort of a steadiness in what we're experiencing in the spread. It's still there. It's still an active concern, but it hasn't spread over a dramatic level. So I think we're encouraged about that. The second thing that we're encouraged about, as I just mentioned and is directly mentioned in David Proper's question, David Proper from the Journal News, is that we have gone through a period of things that could have spiked us And we would have looked at that and said, well, we weren't prepared for the high school graduation season, or we weren't prepared for the 4th of July weekend, or the Labor Day weekend, or the summertime vacation. And in each of those cases, I think because we haven't had a spread, it's an example that we were prepared in advance and we did the things that were necessary. And as Mayor Williams said, and you can see in other communities around, we have opened up outdoor dining in many areas, downtown Scarsdale, downtown Rye, Wheeler Avenue in Pleasantville, parts of Larchmont Avenue in Larchmont set aside for this. And when you see that community by community by community and the spread doesn't increase, it means that proper diligence was shown in the efforts made to open up parts of the. So we didn't do it willy-nilly. We didn't say philosophically, you're imposing upon my freedom, open everything up. We didn't say that. We said that we can open things up, but we have to go through a process of making sure what's sanitized, how do we handle social distancing, how do we handle capacity, and all of those things have been met. And so far, it's been proven by the way the spike hasn't gone. So the disease hasn't disappeared. It's still with us. There's still new positive cases every day. There are still, as we talk about it right now, in the vicinity of 40 people in a hospital that are trying to recover from it. We've had very few fatalities, but we're not through the woods yet. So I'm encouraged, but I'm not by any means cocky. And I don't have a date in mind by Election Day, by Christmas or New Year's Eve. We're going to be through this. We'll be through this when we're through it, and we just deal with it every day.
Okay. The second question also comes from David. Any indication of communities that are doing in-person learning that they've seen an increase in cases? How much is the county monitoring that?
Well, as I said, we're monitoring our cases daily, and I had the map in my hand a few minutes ago. We've looked at those numbers every day, and we share them weekday with the press. I know that there are some publications out there that actually print it up in online publications. I know that myride.com, that Daily Voice, Patch, make those maps available out there, and they also show up on LoHUD and other places. And I think if you monitor the individual communities day by day, there are no particular spikes that concern you. So what I would say is that we're seeing that there's an across-the-board similarity in the relative amount of cases that are occurring from day to day to day, and that similarity tells me that our general policies are working. If we saw a particular spike and then we could tie it to an activity, then we would say, well, how do we respond to that going forward? But the classic example is the one that just happened with Pleasantville. We knew that we had two priests that had done a number of different masses, presided over a number of masses in a whole week period of time, day masses, and then a big Sunday schedule of masses and a special communion event. And when the congregation, when the parish was tested, we did not see a spike in the number of cases, which means what? Which means that the priests who were positive but wore masks when they were celebrating the Mass and sanitized their hands didn't spread the disease. So what's the story? The story is we followed proper procedure, and even without knowing it, people who were positive didn't spread the disease. That's good news. Now, could that change by next week? Yes. Every day I look at these numbers. The numbers could change tomorrow, and 4 or 5 days of change in a row would make us step back and look at what do we have to do differently. So I'm encouraged by what I see, but we're not cocky. We're not strutting. We have to keep working through this. And again, we wait for medical science to give us the word any day now. But we wait for medical science to tell us that here's the vaccine you can take if you don't have it. Just like I'm going to take a flu shot. I guess we're planning to do that fairly shortly. The flu shot will reduce my likelihood of getting the flu. We trust that when medical science gives us a vaccine for COVID, that will help us. And then we'll still have to show due diligence for a while because we are going into the winter season where we tend to spend more time indoors. The cold weather tends to help the virus advance, I guess. And so we'll be tested again. If there are no other questions, I want to thank you for watching. Appreciate again Mayor Bobby Williams of Elms for joining us today. We're scheduled to be back a week from today for another update. I'm not sure which of your colleagues Bobby will have here, but we'll invite one of the other mayors or supervisors to join us, give an update on their communities. If there are any questions from the press with this completed, please feel free to contact Catherine Chaffee. We'll be available for that. I would also highlight that tonight at 7 o'clock, County Legislator Catherine Parker and I will be online. We'll be on a WebEx situation. It'll probably be seen more in her district, which is the Sound Shore area, Larchmont, Mamaroneck, Rye, a little bit of New Rochelle and Harrison, but anyone is welcome to tune into that. We'll talk a little bit about some issues there. I'm going to be on WVOX tomorrow morning at 7:10 and WGCH 1490 on Wednesday morning at 7:20 Q&A. So, we'll try to answer questions as often as the press asks them and be as communicative as we can. I'm George Latimer, Westchester County Executive. Thanks for watching. Have a good day and stay safe.